who we are and what we are. This is a collaboration between Executive Education at the Darla School of Business and the South Carolina Business Review, and its host Mike Switzer and the South Carolina Public Radio. So it's a first for us, I think. So the layout will be this. We're going to start listening to Peter, who has a very interesting presentation in which he's going to explore at a high level what's really going on and what the leadership implications of that are for us all as we go forward. And then there will be opportunities for questions at the end, but those questions can be provided beforehand. In order to ask a question to be addressed by Mike Switzer, who will be our MC for the questions, you need to use the chat function that's at the bottom of the screen. Write your question in the chat function, and then Mike and others will be able to see it and ask that question of Peter at the end. The other thing to bear in mind, please keep yourselves muted throughout the whole event. I should also tell you that Peter will be using a PowerPoint presentation, and that PowerPoint will be made available at the end of this. This is also recorded, and we will keep that recording. We will place it on our website where you can access it there, and that will be available in about 48 hours time. We have to get a verbal transcript for it before we can put it on our website. That takes a little while. So without further ado, I'd like to invite Dean Peter Brews. I'm very pleased you're here to get us off with the business managerial insights, and also to help us understand what's going on at the moment and what we should be thinking about.
Ray, thank you for that very kind introduction, and may I thank you and Mike for hosting this series. I think this is a difficult time for all of us, and it's important that we have conversations like this to help all of us understand what we are facing. I'm just going to quickly share my screen so we can get that going. And once we get that up, I'll start my formal presentation. I'm going to do my best to get through my PowerPoints as quickly as possible, because I do know that power corrupts and PowerPoints corrupt, absolutely. This is an interesting time that we live in, and as you see, I'm going to try and deal with sort of 4 issues, or under 4 headings, and then leave some time at the end for question and answers. It's an honor to be talking with you, and I'm looking forward to hearing what you think about what it is I have to say. So let's go to the first topic, which is thriving in crisis, and what I've called leading strategically with compassion and care. Seems to me that there's sort of 2 ways you can think about the issues facing all of us in business today. I mean, the first one is one of immediate survival. This has been such an abrupt event that's been unprecedented, and how quickly the whole economy just came to a screeching halt. And you have to think about how we're going to survive immediately. But then once you've done that, we'll have to start thinking about the enduring strategic effects. And I think they are going to be more pervasive than people think. And they may be with us for years, if not a little longer. And then there may be some enduring effects that change us as we go forward. All I will say about the 2 immediate adjustment versus the strategic stuff is, obviously after you have adjusted and managed to find some degree of base to work in this new environment, plan for the worst and hope for the best. I do think it's responsible planning for you to try and think, well, what's the worst that's possible here? And let's try and get ready for that. And then from that, develop alternative scenarios, perhaps an average scenario and then a good scenario, but plan for the worst. And it's much easier to say this than to do it, but the ideal is for you not to be crushed by the wave, but look for ways to surf it. And we see examples in Colombia where we have people turning from making alcohol into hand washing materials, and that's been done across the country. Or you look at restaurants who are beginning to now think about only hosting 50 or 40% of their people when we reopen again. All of these are ways to try and adjust for the changes that we face. And I hope that most that are watching this will be able to surf rather than be crushed. Also remember the essence of strategy, which is envisioning a future that is currently not in existence and then setting out to get there. To me, a good strategic plan is a work of creative fiction. And in a sense, what you must now try and do is imagine in 3 or 4 months' time, if we are still operating remote, what will my business look like? What will it have to do? How will I have to change? And under those conditions, set out and go forward from there. Of course, when you are leading with care in times of crisis, communicate, communicate, communicate. I do say tell the truth carefully, and I say carefully because sometimes how you frame the truth makes a really big difference. And be careful what you say, but I would say don't try and protect people from the truth or from the facts. All of us function better when we know what's going on. If we think you are not speaking the truth, we lose trust. And my advice is be candid about what's going on. And when I use the word care, please, I don't mean that you literally have to care for the people. I kind of look at the challenges that we are facing in terms of empowerment. We've just got to empower the people to be able to handle the facts on the ground and do what they need to do to get through this time. You don't have to care for them. It's not a paternalistic top-down type of approach that I think is the best one. It's to basically show that you are concerned about them, you understand their worries and fears, you are compassionate, but most importantly, you give them the data so they can make their own decisions and act intelligently and responsibly under those. There was an article written, published on the HBR decades ago by a gentleman called David Hurst, who talked about boxes and bubbles and effective management. And basically his metaphor for boxes were all the hard things: structure, direction, orders. Those are all the hard things. And he called the bubbles all the emotional, soft, human things that we should think about as we lead. And I just wanted to leave you with the idea that you should combine both hard and soft, both leadership as well as compassion, both strategy as well as vision, to make sure that people get through this. And if you want to get a copy of that article, just send me an email and I'll give you the link to go to. But it's really good for you to think about the hard and the soft, the yin and the yang, the balance of those two things. Lastly, I will say to you that the phrase that I have used in communications is unleash creativity and show grace. And the reason why I chose that phrase is because it's clear to me we're going to have to be creative to get out of this. Mostly humankind has got out of challenges like this through innovation, through new uses of technology, through finding new solutions to the challenges that we face. But while you're doing that, we must show grace. And I'd leave that for you to think about that too. Lastly, a couple of thoughts from Michael Baer, who I think is one of the great sort of theorists in change management. And Michael came out with his model of D times M times P is greater than C, which I list for you there. The basic story here is that if you are going to succeed in change, you have to have dissatisfaction with the status quo. You have to have a new model for where you want to go, given the dissatisfaction. And then you have the ability to have the process and implementation in place to enable you to make that change happen. And all of that has to be bigger than the cost of change or the resistance to change, which you are going to encounter. Notice too that the model is not additive, it's multiplicative. If you do not have dissatisfaction, no change. If you don't have a new vision or model where you're going, no change. And if you don't have the ability to implement and move the processes forward, you're not going to get the change. And then you won't be able to get over resistance. So keep that. We'll come back to that a little later in my talk. To talk a little bit about the second part of the presentation, the macroeconomic or the macro pandemic effects of this, I live in the world of V's, U and L's, and W's. And as far as I can tell, we're going to have one of three victories here. We're going to have either a quick victory where there's a fast down, fast up V, or we're going to have a very slow, steady victory, which basically is kind of like a U, but may also look a little bit like a L, depending if the end of the U drops down. And let's call that slow, steady victory. And then, of course, we can also have a W, which is very fast down, fast up, which turns out to be too soon. Then we go down again, and so on. And I call that victory too soon. It's important for us to realize that V's is what we want, but I think U's and L's are most likely. In other words, it's going to be a slow, steady victory. And most importantly, we need to avoid W's. If we open up too quickly and we end up going back up to where we were before, that will not be good. The path is unknown. I don't think that there is an economist or epidemiologist or a scientist who can tell you exactly how this is going to work out. So the uncertainty is very high. I also want you to know that it also depends on where you are. If you're in an isolated state in the middle of our country, it's likely you will be closer to quick victory. If you are currently, unfortunately, living in New York City or New Orleans or one of the more hotspots, it's going to be a very slow and steady victory, which will take a while. And of course, make sure our leadership does not lead us into victory too soon. These are the moderators of the pandemic that I think are important for us to be aware of. Number one, testing, contact tracing, and isolation capabilities are core. If you don't have that ability, you are flying blind when we try to open up. Treatments for the virus's worst effects will deliver confidence to people. It will make them feel less intimidated, which may then mean that we can get to that quick victory quicker and sooner. And of course, the Holy Grail is the vaccine. Now, why I list those three is because, and of course I had to bring in Keynes, being a business person, the psychology of humans and how they react to this is going to be a key determinant. If we have treatments for the virus, the psychology will change. If we have a vaccine, the psychology will be completely different. But then the question will become, how quickly can everybody get the vaccines and will we be able to scale them? All of these will then lead to how the humans psychologically react to this and will determine how long the U or the L is, if it's a slow and steady, or whether we can have a quick victory because we get a vaccine that's very easy to replicate and we get it through us quickly. All that stuff comes into what the outcome looks like. So let's talk very, very quickly about the pandemic industry effects. Here you will see that I have kind of listed 4 or 5 things that I think you should be aware of. Number one, our 2 key support services, healthcare and higher education, I think are going to be facing quite a lot of disruption. I can spend more time talking about that in Q&A if you're interested. A few thoughts on education. We are worried about whether students are going to be willing to travel. And of course, what happens in the fall if they decide that it's not safe, we may see more people going locally. There's also going to be an increased demand for online education. And this is putting us all under quite a lot of pressure in higher ed. Healthcare, I'll be talking about more so a little later in the presentation, but I can tell you this, that our hospitals were in difficulty even before this happened. And when you end up having to put everybody into ICU-like conditions to deal with a virus like this and stop all your elective surgery, you are going to have immense financial distress in our hospitals. So I do think that we're going to see disruption in healthcare. Unfortunately, this crisis is going to be existential for SMEs, as are big businesses who are experiencing unprecedented effects from this particular event. The most notable long-term effects are likely going to be in travel, hospitality, and especially for businesses that have events where crowds typically congregate. Just in case you don't realize it, a class is an event where people congregate. So ultimately, it is a very important thing for us to be aware of. I did want to put on the ground too that many are going to be able to flourish, and I list some of those that can flourish in these conditions for you there. I was going to take this slide off because it seems to be a little trivial, but you can go onto that website and see the top 100 gaining and the top declining e-commerce categories. Why I put this up for you is for you to think about what would you think if you were in a business like bread machines and suddenly in the space of a week, the demand for your product increased 652%, or alternatively, if you're selling luggages and suitcases and suddenly you lose 80% of your business. It really gives you a sense of how it works out. Have a look at the Stackline website if you're interested in seeing more on this. So let's talk a little bit at a higher level now. I'm moving away from talking about what the immediate effects of the pandemic will be to thinking about this on a more long-term perspective. The challenge is that even before this crisis, our political economy, our country was out of balance. The 2007-2008 meltdown was not a credit crisis. It was an overconsumption, living beyond our means crisis. And basically, 25 years of living beyond our means, both publicly and privately, caught up with us. I need to explain to you what a hospital pass is. It's one of the very few differences between American football and rugby that I can really rally around. In rugby, you're only allowed to tackle the human being who has the ball. Whereas the first time I watched a gridiron game, these assaults going on all over the field, regardless of where the ball was very disturbing to me. But obviously that is American football, and that's why you need padding, because you have people dropping in on you all over the place. You don't even know they're coming. In rugby, when you have the ball, you see the forwards coming towards you. So when somebody's just about to catch you, you flip the ball to the person next to them, they get tackled, they go to hospital, you say sorry. Now, unfortunately, what we have done in our country is healthcare, I think, is a hospital pass. We have not looked after ourselves. We have not really funded healthcare well. And current healthcare, by the way, is bankrupting us. I think it is a statement that you can defend to say, if we don't find better ways to do this, we are going to bankrupt our economy through our healthcare costs. Equally, the average American have not saved enough for their retirement, and neither have we dealt with climate change and global warming. And those three are hospital passes that we had to deal with before we started this. I'll give you two propositions for you to think about. Number one, the average American could decrease their consumption by 20%, and they wouldn't notice it nearly as much as they think. We aren't how much we are consuming. We aren't how much stuff we have. The meaning of life is not nearly as much attached to that as I suspect we may think. And because we have been over-consuming, we can cut down. That leads to my second proposition. Our 21st century early consumption levels of 10 years ago are unsustainable. I'll say a little bit more about that later. So let's look very quickly at the public sector living beyond its means. There you see a very sad story, because these are all the countries of the world that live in the top 30 or so most indebted countries in the world. The number one is Japan, the number two is Greece, the number 5 is Italy, and then you see the other developed countries that are in the world ranking, which is the second, this column that you see there. And this is upside down. As you know, in business, if you're a high growth young firm, you should be able to borrow and you should have debt. Once you get more mature and you become more stable, you should be able to pay down your debt and operate with much less debt. The developed countries in that block are not in that case. You can see that America has debt of 78.8% of its GDP, and that we are ranked number 36 in the world. You also see our national taxes at 17% and our budget deficit at -3.4. Know that, by the way, our public debt is not only 78%, because we also have had intergovernmental borrowing, which is basically Social Security lending to our government, and our national debt is actually 106% of our GDP, which would put us just below Singapore. Equally know that the taxes there for America are not correct, but fundamentally we have about 11% state and local taxes, which puts us up at about 27%, which then gets us down to the average of the world, which is the last story there. You have all that data. I may refer to it in the questions. This is a story which shows you what our gross federal debt, that's both public and private debt, which I mentioned just now, that's also the debt intergovernmental, has looked like since 1800. You will notice that we borrowed up to almost 120% of our GDP to fund the Second World War, paid it all off by the 1980s when President Reagan came to power, and since then, debt has just climbed back up. By the way, this is only until 2016, and you will notice that we had a brief respite in the late 90s with the dot-com boom, but this is the example of our country living beyond its means from a governmental perspective. There is data from the whitehouse.gov website that shows you the previous slide more technically. Same thing you will see there. What you see there now, by the way, is government savings. And what is alarming, of course, is how quickly we had to borrow to fund the meltdown in 07 and 08. We managed to dig ourselves out slowly until 2015 and to 2015, yes. And then, of course, in 16, we started to go back down again. And this only goes up to the end of 2019. And you will notice that we have gone back the way down to about an $850 billion dissaving. And that does not augur well, because this crisis is going to cost an immense amount more even than the great meltdown we had in 7 or 8. That's not good news. I've put this up here so that you can see GDP growth rates, receipts and outlays, and surplus deficits for the last 20 years or so. But notice what happened in the Great Recession. And you will notice that we lost about 3% of our GDP in 09, and that we had to increase our deficit of our government quite seriously from 1% in 7 all the way through to 8 or 9% in in 10 and 11. And of course, we managed to start bringing it down again, but now we are creeping back up. We are now at 4.6% deficit of our government expenditure, receipts and outlays. And that also doesn't augur well, because we've introduced trillions of dollars of new debt in the last 3 months that is now going to be added to this. I wanted to mention these aspects too, PCTRs, which are personal current transfers, receipts. I define them for you there. These are basically two things: medical benefits to pay for our healthcare, Medicare, Medicaid, and Social Security. And you will notice that almost 70% of PCTRs in 2005 were made up of Social Security, Medicare, and Medicaid. That's what I meant to you when I said to you that our healthcare is going to bankrupt us if it carries on the way it's going. I also got some data in 2013 to show you what the state looks like. And again, you can look through these at your own time. But fundamentally, you can see that Social Security benefits to those in Wyoming and medical benefits to those in Wyoming, and of course, Medicare benefits just below that, were a big number, almost over 70%. And these are transfers made to people out of our national wealth each year, which is really disturbing. If you want the overall picture of PCTRs, there they are all together. This is the total PCTRs over the last 50 years or so, 70 years in fact. This is Social Security payments. This is Medicaid, and that is unemployment insurance. This is going to shoot up now, even worse than it did in 08, 09. But basically, this shows you that about $3.2 trillion in 2020 will have gone out of our government for Social Security, Medicare, and unemployment insurance. This is defense. It's not counted in PCTRs, but I wanted you to get a perspective on where defense was. And you will notice that it's at about the same level of Medicare and lower than Social Security. And these numbers are all going to go up exponentially as more and more of our older people retire and need health care. So let's talk very quickly about living beyond our means privately. And what you have here is home prices going back to the 1880s, together with building costs, population in our country, and interest rates. I could talk to you about a little bit of how when interest rates started going down from the 80s and then moved all the way to money almost becoming free in the mid-2000s is what prompted the housing boom and people go out and buying houses. But fundamentally what that set up was this. And this is a bit of a confusing graph because on this side you have mortgage equity withdrawals as a percentage of GDP. And on this side, you have consumption as a percentage of GDP, and it brings these two together. And you will notice consumption in the sort of more blue color from the 50s all the way through till the mid-90s was no more than 65 or 64% of GDP. And from that point on started to go up dramatically to over 70% of GDP by 2007, 2008. You will also notice how closely correlated it was with mortgage equity withdrawals. And what that tells you is that we used our housing equity or our housing gains as an ATM from about 2005 all the way through until 2007. In fact, it was about 2003, I think, to basically increase our consumption without backing it with productivity. In effect, we borrowed our increased living standard. Of course, what then happened is the market crashed, mortgage equity withdrawals tanked, and the federal government had to step in to lend money and to provide stimulus, which was much smaller than the current stimulus, just to keep the economy going. And what we've effectively now done is exactly the same thing, but borrowed even more, 4 times, 5 times that amount to enable us to keep this economy going in these very difficult times. I don't know what the numbers are going to look like with regard to deficits of government expenditure, national debt, but they are going to go up dramatically over the next year or so as a result of this. And they were worrying even before this happened, when before the pandemic occurred. That's a cheeky question. Does our Earth have COVID-19? No, of course it doesn't. But I wanted to use this as an opportunity to, number one, underscore what happens when you ignore facts and science and you react too late. And ultimately, I think we face the same thing with climate change, global warming, which I call CCGW. If you want information on climate change or global warming, the best place to start reading is the Stern Review, which was produced by Lord Stern, who was a World Bank economist and asked by the Blair government in Britain in 2005 to produce a comprehensive report on the risk of climate change and global warming and what its economics would look like. And they showed there the tremendous challenge we face with this particular problem. And I wanted you to sort of imagine this, that imagine Earth slowly being infected by human-produced carbon, just like the initial COVID-19 infection is currently moving globally. And our scientists have been warning for almost 20 years that we have very little time to act before CCGW effects become irreversible. That was said 15 years ago, and what we do in the next 10 years are critical. And if we don't, I worry we're going to be like somebody who got infected with COVID-19, whose immune system couldn't deal with it, and 2 weeks later we discover it started to replicate in our systems, and then it becomes existential. I would prefer that not to happen to climate change, but we are at risk in letting that happen. 2 more slides and we are done. I give you the summary there for the World Bank conclusions on climate change. Please read it in your own time if you would like to. As far as I can tell, even before the pandemic, we had to reduce our consumption as a percentage of GDP to bring it down from over 70% to somewhere close to 65 or 66. We also probably need to increase our taxes. If you remember, we had taxes of about 28% of GDP, which was at the world average. Given the debt we've taken on, given the Social Security, Medicare overhead that we face, I don't think that we are going to be able to operate at the level of taxes that we are at the moment. We're also probably going to have to deal with entitlements because we will not be able to afford the level that I think people think we can, which then means we may have to cut entitlements over the next 10 or 20 years. And I just put in food consumption because fundamentally, if we don't eat less and get involved with being more careful with ourselves on a wellness perspective, we're not going to be able to treat ourselves out of either this crisis or even where we are now. There's my suggestions what we should do individually. Number one, live within your means and demand our leaders do too. Be fact-based, data-driven. Realize that those who have a little may need to contribute a little more and those who want to expect a little less. Insist we start to address the healthcare, climate change, global warming, hospital passes, and move to get our political economy into better balance. But please keep the perspective. Though we're out of balance, we face less adjustment than many others do. If you think we're in trouble, there are others that are in worse trouble. Not that that really matters, but I put in the now because if we sit on our hands for another decade, I think we're going to be in severe trouble from a climate change, global warming perspective, and from a financial perspective, when the world suddenly decides that we won't be able to pay our debts, that we aren't willing to discipline, they may suddenly dump the dollar and lose their trust in America being a stable society. And I would hate to get to that, which is the longer term risk we face if we don't start adjusting now. There's no quick fix. We must show character, we must defer gratification, demonstrate discipline and commitment to our greater good, and take personal responsibility, especially for wellness. If you really want to live a long life, don't eat unhealthily, get unhealthy, and then expect the healthcare system to buy you out of it. We will not be able to afford that. And if we all take personal responsibility, good heavens, we'll get back into a much healthier form as we all should be. And you will see healthcare costs drop all on their own without having to treat people for it. I know that that's a very sensitive thing to talk about, but we have to find ways to bring it to our national conscience. I guess the only good news out of this crisis is my last statement. Let's not let this crisis go to waste. I worry that we let the 07-08 crisis go to waste a little. Please don't let it happen again. That's all I have to say. Thank you, Mike. Let me give you back the screen and we will take questions.
Okay, I think I'm unmuted now. Can everybody see me and hear me? We're good. So I do have a question for you, Dean Brews, that came to mind when you started talking about football.
Yeah.
So we have a huge economic impact involved in football, and the University of South Carolina, of course, a beneficiary of this economic impact, the state of South Carolina, the city of Columbia. I'm sure that this discussion is happening at the school. Can you give us any kind of update on what the likelihood is of that economic impact returning this year?
Well, I think I can answer that question by saying to you, I'm not sure it's likely we're going to be having football games in the fall. And I think that anybody who is dealing with big crowds and looking to convene big crowds may have to wait a while for that to happen. Now, again, that predetermines that we don't have a successful treatment that can put the worst effects at bay. We don't get a vaccine that comes into place, and we are still worried about stabilizing transmission by then. So I'm not sure we're going to see, big athletic events, certainly in this fall. I know that we're talking about this at the University of South Carolina, but I'm not privy to that sort of conversation, so I can't add anything more than that, unfortunately. It is very worrisome. And I think it has a lot of knock-on effects to hotels, to restaurants, to bars, to hospitality people that obviously enjoy when the big crowds come into Columbia. I don't have any quick answer to that, apart from that you may have to operate on a suboptimal basis to much smaller crowds for a longer period of time. I worry it's going to be a number of months before we really get back into ops normal for any of these types of activities.
That's kind of the answer I was afraid that you were going to say.
No, I'm afraid, Mike, what you'll also learn from me, and please understand this, number one, everything I've talked about here is my own personal opinion. And yes, I am thinking at this point the glass is half empty, not half full. You will find others that are opposite to me, and they may be right. In fact, to be honest, I hope I'm wrong. I may not be, and I'm just calling it as I see it is.
And let me remind everybody too who's participating in this that to use the chat function at the bottom of the screen to send in any questions that you would like to ask of Dean Brews during this Zoom conference. Now, Pete, what about the current oil glut that we all of a sudden have with tankers being parked off the coast of this country and can't know where to put the oil because nobody's using it? And I'm sure that this drop in activity, the oil glut itself, is helping your CCGW issue.
Yes,
correct?
well, it certainly is clearing up the atmosphere for a while. And these are extreme measures to go to deal with climate change. But I think in the short run, it'll actually make it worse, because if you really think about it, what we have to do to oil is we have to make it more expensive. I happen to be a person who strongly supports a carbon tax, because if you don't make the underlying asset more expensive, the market cannot find alternatives. And what's been happening in the oil market for at least the last 10 or so years is every time it gets to a point that, you know, people start to bring in alternatives, they just drop the price and drive them out of business. And what this is doing is it's making any other alternatives even less likely. So I would say in the medium term, 3 to 5 years, were I king, and you can be thankful I'm not, I would be looking to slowly ratchet up carbon taxes so that you make oil more expensive to make alternatives cheaper and force people to go there faster, which in the short run will cost us, but in the long run will solve the problem. What's now going on is a disaster for the oil producers. It's a disaster for the people in shale in Texas and in other parts of the country. And yep, some are going to go out of business as a consequence of it. But when we pick it up again, they'll get their production back up and will be no different than where we were before the crisis happened.
Now, going back to that point that you brought up about consumption here in the United States, and the fact that we, you know, maybe we didn't need to be buying so much stuff that we've been buying. Well, obviously nobody's buying that much now, and so and this is probably going to take that slow but sure recovery that you mentioned. So do you think a new baseline might be being formed here for personal consumption, for GDP, after this is all over?
Yes, I think that is the case. It was always interesting to me whenever I took our students to Europe when I was at the University of North Carolina working there. The Europeans would look at us and say, you don't live to work. You know, you work to live. And we can't understand how much Americans seem to want to work and consume. And in effect, what used to happen in that program is in August, most of the Europeans would take August off. You couldn't get anything done while they were on vacation. And we in America have always been very driven and very work ethic and very consumptive in our circumstances. In fact, if we consumed less, I think there's a fairly good chance the quality of our lives would go up. Now, we would have less stuff. Our houses wouldn't be as big. We'd have to be more comfortable with, you know, less. But the meaning of life is not what stuff you have, it's who you're with, it's the quality of the interactions you have, et cetera, et cetera, et cetera. And I'm hoping that we can get this message out into the polity to turn that into a cultural variable. What then happens is as we recover in a more balanced way. Now, let's be clear on this. It also means that you won't have to work as hard. It also means that you will only get 80% of your income, not 100% of your income. It also means that the US GDP won't grow as much as it might have in other ways. But we will get more balanced, and I suspect we will find we will still survive. It may be surprising for our, you know, our viewers here to hear the dean of a business school saying to pare down a little, but I do think that we got out of balance and we were borrowing our consumption. We are currently borrowing our consumption by just, you know, taking money out of the government, which is probably going to have to be funded through future taxes, So in effect, we are now consuming for what our children may need or our grandchildren may need for climate change. And all of those things basically let you know that we need the better balance. I'm hoping it happens.
All right, great. And if there are any other questions, just remember to use the chat button down at the bottom of the screen. And I guess maybe one final question, Pete, would be that what are some, summarize for us what just the key issues are here for our business leaders on what that are pandemic related with, with their business, with just the business environment overall. What are the key issues that they should be thinking about?
For all business leaders, they should be number one, thinking about business survival firstly. And I would say to them that this is going to be, an event that's going to go on longer than I think we initially expected, and they should plan for that. The second thing that they should be careful of is making sure their employees are informed and understand the challenge, and they are doing their best in a I'm here to care for you way to keep them, well looked after and employed. I think after that, they should be thinking about what changes can I do to become a surfer of the wave as opposed to being crushed by the wave, and then just hang on and hope. And I mean, try and adjust your business to take into account the context that we now face. And after all, that's what businesses do. But I would say to you at this point that be very, very, careful on that and make sure that you try and adjust as quickly as possible to the challenge.
All right, and we have a couple more questions that have come in. How do you think employees working remotely, that this has impacted productivity?
Now, that's a really interesting question because it impacts productivity in some ways, and it depends upon where you are. If you're a person like me who's fortunate enough to not have, children and other family issues to deal with on the same time, I actually think I can be more efficient. The commute is really good. I'm here at 8 o'clock in the morning and I can work and there's nothing that gets in the way. So fundamentally, I think for some people, productivity can go up. And by the way, there are a number of people around the world who've been working virtually for decades, and it's nothing new. And I think this is likely to be one of the other enduring effects of this, is a lot of people are going to find that they can work remotely and don't need to come in and save a lot on that. That will boost productivity. For the people that are now dealing with family issues and in a small space and don't have good bandwidth and have issues like that, it's very, very difficult. And I deeply empathize with our staff and our faculty that are currently trying to negotiate their work under these conditions. Those people's productivity is not going to go back up again to the same level until we get back to where we were, a month and a half ago. So it depends where you go. I think the long-term effect is going to be that many more firms are going to be doing a lot more online than they were, and I think that will be enduring. Online education is going to grow. Online selling is going to grow. I was talking with a group of people from the University of South Carolina earlier this morning who are now beginning to put up a website to enable the world to know who they are, to start to fundraise for that organization, which they had not been doing before. And once you've done that, it becomes a permanent part of your infrastructure and it'll really be part of your operations. So I think the whole virtual side of business is going to increase reasonably dramatically as a consequence of this.
All right, and then another question is, while you say we need to reduce social and medical costs need to drop, easy to prescribe, but can you be specific on how to do this?
Yeah, this is when it starts to get a little bit touchy. But all right, I mean, diabetes is an enormous problem that we face, which comes from overeating, which comes from obesity. And we are, 2/3 of our adult population are supposedly obese. The only way that we can deal with that is for people to just take control, exercise, eat less, and slowly, reduce weight. And that's why I emphasize wellness. And it beats me that we have spent so much time trying to deal with the effects of our conditions and just treat the disease, as opposed to go to the cause of it and just get ourselves back into balance. If you have a look at a movie made in the United States in the 1970s, you will notice that the people are much thinner. So I know we can do it. And I would just emphasize that people should be aware much more about this and start to become really, really committed. By the way, may I add that this virus has found those type of people that are in that condition to be unfortunately more viable for the virus than otherwise. So in an effect, this is a show that tells you that if you are unhealthy in this way, you raise other probabilities too, and this virus happens to play into one of those, which explains why we have such the effects that we have, which is a great tragedy. And look, I will give a personal testimony. I don't often do this, but I'm going to. I'm a type 1 diabetic. I've been taking insulin for 30 years. And I have to do it because my body does not make those hormones. But I can tell you this, I am perfectly healthy. I go and see a doctor once a year. My medical costs have been nothing. And I hope it lasts for at least another 15 years. So I know all about diabetes. And I can tell everybody that's listening or viewing this, you don't want diabetes. So please do me a favor. Take control of your health, be responsible for your own personal health, and get yourselves into a better shape. And Mike, I've been talking about this as gently as I possibly can at the business school, and I know that it is laden with all sorts of political overtones. But honestly, if we don't take charge of this, it's going to bankrupt this country. I think it is a legitimate national economic security thing to say that if we do not get control of this variable, we're going to bankrupt this country. And we need to then start talking about it, which is why I've stood up and said this today.
Dean Brews, that's going to wrap it up with the questions. So thank you very much. And I guess we'll turn it back over to our original host, Ray Smith. So Ray, take it away. And I'd just like to remind everybody that the next installment in this series that the South Carolina Business Review and South Carolina Public Radio are doing in conjunction with the Moore School. The next installment on the radio airs this Wednesday morning. And of course, it's also available as a podcast. And then the next Zoom conference related to that interview will be this following Monday.
And Mike, may I just say thank you to everybody for participating and joining us. Thank you.
Yeah, thank you, Mike. And thank you very much, Pete. That was a really interesting talk. I think what Pete has done here, which you don't often hear in such situations, is give us the high level view to understand why it is we're in the situation we're in. I found that fascinating from rugby. Hospital passes and rugby is something I care about from my past as well, so I got that analogy. Where we're going next, we have a series of other presentations, and we're getting down now to a level of what is it that businesses should be really grappling with. So the next presentation, we have two of our professors, Professor Mark Cicchini and Professor Janice Ferguson, who will be talking about, well, what are the financial implications of what's happening at the moment for your businesses and how should you go about managing them, and also how to take benefit from the CARES Act that's out and about at the moment. And then we're going to move into other topics such as needing a succession plan when you don't think you need it, and suddenly we do. And thinking about what happened in the UK recently, where the Prime Minister suddenly went into intensive care and there was no backup plan. It can happen to all our organizations. And we're going to be going through virtual team working, how to create performance from a virtually distributed team, and so on and so on. Please also remember that Pete's presentation in its entirety will be available in about 48 hours time. It'll be on our website, Executive Education and the Darla Moore School of Business. And with that, I think, and the PowerPoint will be coming out very shortly. So Pete, once again, thank you for kicking this off. It was a great start. Now we get the big picture. Now we're going to move down to what it is we need to each do in order to help our own businesses, our own economies thrive. So thank you very much. And thank you, all of you, for attending. Please get the word out. Let others come and join us. They can share the videos, share the audio files that we have there as well from the South Carolina Business Review. And Mike Switzer, thank you to you and your colleagues back at South Carolina Public Radio. With that, bye.